Yes, definitely. Thank you so much, Tanya, for both organizing the conference as a whole, but also making it possible for myself and others to present virtually. I am currently at the University of Waterloo in Canada, so about 5 hours behind you guys in Barcelona. Um, what I'll be talking about today is looking at climate and mental health, exploring the intersection of schizophrenia and atmospheric science in the context of an urbanizing world. So when I start thinking about this and moving through this type of work, I want to briefly give an outline here, looking at the urban heat as well as urban design and why heat matters in terms of our urban planning. I'll do a little bit of description around neuropsychiatry and extreme heat and some of the physiological impacts of urbanization and heat before looking in a specific model, the distributed lag nonlinear model, and using that to explore hospitalizations associated with schizophrenia in the results section, looking at relative and attributable risk from air temperature on schizophrenia. And then I'll wrap up with a little bit of the implications around what does this mean, not just for the vulnerable population of those with schizophrenia, but also more broadly at the healthcare system. So I don't think I need to go into a ton of detail in terms of what the urban heat island is. I think we're very much aware in this context of that. But we also know that historically we've been aware of the urban heat island for nearly 2 centuries now. In 1833, Luke Howard identified the urban heat island as a phenomena in London, and shortly after, and around the same century, early designers began looking at how we designed our cities and identified in some ways a nexus between the urban design, the climate, and our mental health. In the mid-19th century in the US, Frederick Law Olmsted and his brother began proposing urban parks as a solution specifically for the mental strain of city life. These are just a couple of quotes from a few different places where Olmsted argued for this. In one place, he argued that incorporating the natural scenery into cities is to give the mind a suggestion of rest from the devouring eagerness of intellectual strife in town life. He also argues that public parks have a common good and a space for the public and for people in general to gather. That they're also open and accessible to all people. We now know the value of green space in terms of mitigating the impact of the urban heat island by creating some cool spots within the city. But we're also seeing from Frederick Law Olmsted that there seems to be a anecdotal experience of there being a benefit to urban green space to address mental health concerns as well. In the UK, around the same time, Sir Ebenezer Howard conceptualized what is called the Garden City. And he proposed this as an idyllic solution to the urban challenges of an industrializing Britain. And this image on the right here is from one of his books, where he proposed that we should essentially decentralize the city and create lots of green space throughout the city. And so that where people are living, where they're working, and the commutes in between should be better distributed such that we have more green space built within these areas. He proposed this in the UK, but it was picked up in other parts of the world, particularly amongst various places that were colonized by the UK. But one great example of this is in Singapore, where they have advocated now for decades of being a city in a garden, and have continued to push for more and more greenery within their urban contexts. So some key points from both Sir Ebenezer Howard and Frederick Law Olmsted are that they both identified that increased contact with green space and green infrastructure can improve both thermal comfort as well as improve mental well-being. Specifically, some of the types of things that Sir Ebenezer Howard identified were things like when we add in more gardens and green space, that we have no sweating, that there's pure air and water, no smoke. We also see a reduction in things like crowded dwellings and in the isolation of crowds. And Olmsted specifically brought nature to the urban dweller. Some of his big accomplishments include Central Park in New York City, one of the prime examples of urban green space, and it being a key identifying piece of the city. From the 19th century, if we shift into the medical side and neuropsychiatry, here's just a few examples of environmental psychology advancements. In the 80s and early 90s, researchers found that individuals who were placed in a recovery room that was exposed to vegetation in a hospital, whether that was live or artificial, found that their surgery recovery times decreased. So even in a hospital setting, we see improvements simply from the exposure to greenery and green infrastructure. As we move into the late 90s and the 2000s, we see researchers looking at public housing units in Chicago and documenting higher levels of aggression and irritation from the residents that didn't have a view of vegetation from outside their window. From there, we begin to see more and more of an advocacy for green space as a public health benefit, and not just from a mental health perspective, but in all aspects of health. In the mid-2000s, we also have more and more research that starts to point to the specific impacts of things like schizophrenia on our ability to thermoregulate our body. Hasegawa et al. In 2005, as well as Chong and Castle in 2004, identified that thermoregulatory activity within the brain is impaired by schizophrenia as a disorder. And so for individuals with schizophrenia, they were identifying that they're at a higher risk than the general population for extreme heat issues because their brain, due to the disorder, is unable to tell them or inform them that they need to take precautions due to the heat outside. So their body isn't going to begin to sweat to start to cool it naturally. They're less likely to realize that they're dehydrated. They're going to be less aware of the sun's impact on their skin as well. And so they are at a higher risk than the general population because their body isn't informing them in the same way that the general population is. As we get into the late 2000s, we begin to see that there are consistent patterns, both in terms of atmospheric as well as urbanization processes and patterns that are influencing psychosis broadly. And the March et al. Paper supports a social context for etiology across a variety of different psychoses, including schizophrenia. We also see in the early 2010s that mood and self-esteem as well are improved under 5 minutes of exercise in nature, and that is also associated with a reduction in depression and anxiety. They did not necessarily tease out the green space side of that versus the activity in terms of exercise, but we're beginning to see that specifically within nature, there were some bumps in their mood and self-esteem. There's also an added benefit or synergy with blue infrastructure as well. So green and blue infrastructure together playing a role. And as we move into the more recent research areas, we see that mental health is now being advanced as an ecosystem service. So if we think about the way our cities and our landscapes are built and designed and the services that they provide to us, then we should be thinking about what are they doing in terms of our mental health as well. Lastly, in 2022, research showed that even our sleep is being negatively impacted by climate change and as well as urban heat in terms of overnight temperatures being warmer, and that resulting in negative sleep outcomes. So all of this sort of coming together in a paper that I recently published in the Journal of Urban Design and Mental Health, where I propose to think about the impacts of our urban design through an urban climate lens and its impacts on our health. So we know that both extreme heat as well as urbanization are playing roles on us physiologically and psychologically. So in urban heat, we see increased heat stress and heat stroke. There's decreases in thermal comfort. We also can identify respiratory problems, both associated with the heat as well as air quality concerns within the urban space. Psychologically, we're also seeing increases in aggression, irritability, depression, and schizophrenia that are associated with both urbanization as well as extreme heat. So collectively, these two pieces together bring me to looking specifically at the study of air temperature and schizophrenia together. This is just a few samples, including the work that I will discuss in just a moment, across the globe. So this is stuff that is being identified in terms of weather, not just air temperature, but amount of sunlight, cloud cover, humidity. A variety of different weather and climate variables have been explored across the globe as they relate to schizophrenia. I will focus in on and talk in more detail about the Arizona one that I published in 2023, but we can see that it's happening in high latitudes, low latitudes across a variety of contexts and cultures as well. Different climates are also being represented here. And so this is a international phenomena that seems to cross all these different traditional boundaries and barriers, and is a further impetus for us to continue to explore this relationship. So the statistical model that I use to look at schizophrenia and air temperature is what we call a distributed lag nonlinear model that was developed at the London School for Hygiene and Tropical Medicine by Antonio Gasparini. But essentially what this model does is that it takes the total count of hospital admissions for schizophrenia and makes it a function of not just air temperature, but we also want to control for things like trends over time, seasons and weekends, as well as, because we're looking at hospitalization records in the US, the holidays and weekends play significant roles as to when or if people visit the hospital for these conditions. We tested a variety of different weather variables to accomplish this, but we found that minimum temperature played the most significant role in terms of describing and being correlated with the total counts of hospitalization data. So we used minimum air temperature, daily minimum air temperature from day 0, so the day of it happening, lagged backward in time to a full week out. And this model is specifically designed so that we can begin to look at those lagged relationships, but we can also isolate down to individual days, as well as getting an attributable risk to specific ranges of air temperature as well. So some of the cumulative results that we see as we look across all day 0 to day 7 data is that, generally speaking, we are seeing for all individuals that there's an increased risk for hospitalization associated with schizophrenia in the extremely cold and extremely warm overnight air temperature conditions. So on the left here is for all individuals within the data set. On the right is for only male. This data set includes around 86,000 cases from 2006 to 2014 in the Phoenix, Arizona, Maricopa County area. Of particular interest to us are those overnight temperatures that are warm, particularly as we think about the climate of Arizona. You may be wondering to yourself, we have an inflection point in both cases of around 30 degrees Celsius. And you may think that's rather warm, and it is. However, that is also the average low temperature in Phoenix, Arizona for the months of June, July, and August. And that has continued to get worse in recent years. And as we think about summer 2024 in Phoenix, it has been another brutally hot, unrelentingly hot summer there. And we don't really anticipate with climate change there to be a relief from this as we move into future summers. So that right-hand side of both of these graphs becomes particularly important as we think about urban heat as well as climate change pushing us and the temperature distribution further and further to the right. So with this, we saw that males have a slightly higher risk for this hospitalization compared to females, but it was not statistically significant in its difference. We then took this data and attributed the temperature data and the hospitalizations to different types of overnight temperatures. So we broke them into hot, warm, cool, and cold nights, where hot and cold are your 10th and 90th percentiles. Warm is the 50th to the 90th, and cool is from the 10th to the 50th. So we took apart the full distribution and broke it into 4 different groups. From that, we were then able to attribute specific numbers of cases within the data set that could be attributable to temperature. And then we built out a cost estimate for what the healthcare cost was for each of these cases. We use that using US insurance data as well as hospital records, where the cheapest or the most conservative estimate for the cost of these hospitalizations is using an uninsured patient, where each case this is in Canadian dollars, and I didn't change this over into euros, but in Canadian dollars, it's around $11,500 per case. In US dollars, that's around $8,500 per hospitalization. So when we look at these cumulative totals in Canadian dollars, we are seeing over a 9-year period a steady amplification of the healthcare burden of these hospitalizations. Over those 9 years and across all temperature conditions, we saw a total healthcare burden of temperature on schizophrenia hospitalizations to be around $35 million Canadian dollars, or 3.9 million Canadian per year. And again, that translates to numbers that are approaching 3 million US per year in terms of the cost in terms of healthcare burden. If we think about this not just as this is an additional burden of $3 million per year for the healthcare system to carry, it's also impacting insurance premiums, it's impacting wait times at emergency centers, and also the number of hospital beds available to other conditions and other people needing medical attention that are fully attributable to simply the air temperature. So when we think about that within the broader context, as I've been advocating for, of the benefits of green infrastructure to address this mental health, we've seen that mood is directly impacted through nature contact. We also see mental health now being advocated for as an ecosystem service. We can also think about particularly green infrastructure as an ecosystem service to address urban heat as well. So in some ways, the green space can then be argued for multiple ecosystem services and benefits across both the health as well as the physical climate conditions of any given city. Brotman and al. Are the ones who proposed the mental health as an ecosystem service, and they highlight that evidence is supporting an association between various common types of nature experience and increased psychological well-being, and that this results in a reduction of risk factors and burdens on some types of mental illness. And I would advocate through the work that I've done that schizophrenia is among those types of mental illnesses. So broadly speaking, we can see that urban green spaces, while originally proposed as an intervention to provide mental peace in the middle of a bustling city, we're seeing it also as a benefit in terms of addressing urban heat, and that there is scientific evidence that's pointing to both the urbanization and extreme heat as factors in deteriorating mental health across a variety of countries and contexts. So ultimately, we can see through this that there is a potential for urban green spaces to provide both cooling and calming benefits to urban dwellers, in addition to other ecosystem services that have been identified of green space, such as reducing urban flooding and biodiversity concerns within the city. So I will stop there. If you guys have questions, I'm happy to answer them. I might need to go through Tanya to get the question asked. But if you also have just general questions, you can contact me through a variety of channels, or you can check out either paper. The QR codes and the citations are on this page. Thank you.